I want you to imagine yourself. You just graduated medical school. You're savoring that thought, that feeling. And you're walking down the river, enjoying a beautiful day. And you notice a body floating on the river. You jump in, you grab the body, you pull it out, you resuscitate that body. You drag yourself off the bank, call 911, and as you hang up the phone, you look in the river, and there's 2 more bodies. You jump in, you grab those 2 bodies. You resuscitate them at 911, can't get there quick enough. You start calling your friends. You look up the river, there's 5 more bodies, there's 10 more bodies. There's 20, there's 100 more bodies. Fire rescue's out there, the community gets involved, you build a dock, then you build a clinic. And in short time, that clinic's not enough. Now there's 1,000 bodies, now there's 10,000 bodies coming down the river. So you build a big public hospital. Even that's not big enough. The community gets together, elected officials go out, you pass a half-penny sales tax, you expand the hospital. Of course, this is Dade County, some of the people took the money for other reasons, but we'll keep that in mind. Somewhere along the line, you sit there and you go, we keep building these hospitals, we keep building these clinics, we keep concentrating our policy and our efforts down the river. Why doesn't somebody just think about it and say, for God's sakes, why don't we just fix the bridge? Why don't we deal with the social and public issues that are causing all these illnesses? Do you realize that for the first time in the history of this country, my children's generation will not live as long as mine? The first time in the history of America. That's pretty unacceptable to me. You realize we're more than 2.5 times more per person in cost for healthcare, and we rank some of the worst. What's going on here? You know, when I was in medical school, my youngest sister, who was studying up in Gainesville, wanted to spend her 18th birthday with me. She never made it. She was killed in a car accident on the way down. And it was interesting. That event in my life taught me 2 incredibly important lessons in my career as a physician. It taught me how it felt to lose somebody I loved, which became vitally important when I had to give bad news to patients, because doctors do that. And I also made a promise to God that if I ever got to be a doctor, I didn't want anybody to die or suffer alone, because I never got to say goodbye. There's a problem when you make a promise to God. Not a whole lot of places you can hide. But this is Miami, and I found City Hall. And apparently God does not frequent there enough. But nonetheless, God will test you. And one of my first cases was a man who was dying of miliary tuberculosis. That's tuberculosis that has spread throughout your entire body. Intubated in the intensive care unit. A little wristband had his name, date of birth, which quite didn't correspond to the face I was looking at. And it said no address. That meant fire rescue had found them under the bridge. What was I going to do? I had made this promise to my sister. I have a man dying in front of me that has at least parents, perhaps siblings, maybe a spouse, maybe children, and nobody knows he's dying there. In Miami, in its less than compassionate ways, this was back in the early 80s, you remember, we were in a recession, and then we added a couple of things along with that called HIV and crack cocaine, just to make the situation worse. And I found 2 shelters. And what I found was a window into a world of poverty that existed in the city that I grew up in the city that I was born in. Something that was unacceptable. I went to a conference out in California. I called a friend of mine, Alina Peristavas, a social worker, and we gathered people together and we started a clinic for the homeless. What a great accomplishment, right? What am I doing? I'm building a dock and I'm building a clinic down the river. And in 1999, we built a 1,600 square foot clean, brand new clinic right off I-95. The biggest failure I have had in my professional career. How can you applaud a triple expansion of a homeless clinic, which it only means more bodies are floating down the river, that we as a society did nothing to take care of those that have so little? So, what are we going to do about that? And And why are we going to do something? Well, I'm going to tell you why we're going to do something. Because I'm embarrassed by the statistics our country has. I'm embarrassed by the fact that my profession, from academic medicine to the implementation of my profession, we have failed America. Why have we failed America? Because my kid's generation is not going to live as long as I do. Oh, my daughter will. Because she meets the criteria. Somebody asked me the other day, what does it take to be healthy? Well, being white is good. Being rich is better. And being educated is vital. But not everybody can be white, not everybody can be rich, but people can be educated. And those that are educated will live longer. And they will live healthier lifestyles. Why? How is America doing compared to other industrialized world countries? Well, let's see, we're 2.5 times more expensive. In the state of Florida, we're 50th in the United States in uninsured adults, 49th in children. Miami-Dade County in 2002, when we had money, more than a quarter of our population here had no health insurance. And who are these people without health insurance, for God's sakes? It must be those homeless, right? Well, actually not. 70% of those without health insurance had at least one family member working full-time, and 12% had part-time workers. In the United States, in the 8 top industrialized nations, if you look at infant mortality, we are double, twice as high as Japan and Sweden, and at the very bottom of that list. And life expectancy at birth, we rank at the very bottom again. For males, 75, for females, 80. Excuse me. Unless you're African American, poor, or another minority, then you can take 5 years off your life. Those are the real statistics. That's the reality that happens. We need a new paradigm in medicine. We need to start looking at this differently. We've gotten some great technological inventions, scientific inventions, the genetic discoveries, the type of medicine that we can do. Because you know what? We've become a profession that intervenes. You know, in America, if you show up in an emergency room, we'll take care of you. However, we won't let you die, but then we discharge you. And apparently we don't really care if you suffer or not, because we'll wait for the next time you come into that emergency room. In 1909, the Carnegie Foundation got with Hopkins and hired a gentleman by the name of Fleckner to do a report on American medicine, because at that time there were concerns it wasn't scientific enough and maybe medicine was too interested in money. Yeah, we got rid of both of those, didn't we? Well, anyways, he came out with his report, which has been the tradition of American education in medicine for the last 102 years. It just so happens, though, by the way, if you read carefully into the report, apart from him pointing out the issues of science, he was a bit sexist because he recommended no women should be doctors, and a bit racist because of the 7 black medical schools he recommended we close 5. And American medicine has maintained those traditions. So, what is the great thing? The great thing is this country decided we didn't have enough doctors in America. We're short on doctors, so we need 25 new medical schools. And at FIU was one of the new medical schools, as a matter of fact, the first new one of the new millennium. And what's the opportunity that comes up when you have a new medical school? You could do things right. You could make it the way it should be. And we can increase the capacity. This we can control. In the state of Florida, by the way, 77% of physicians are male, 78% are white. That's quite a diverse crowd, I might add. And the average age is 55 right now. So we're coming towards the end of our runway. What kind of doctors do we need? We need primary care doctors. We need appropriate distribution of doctors. We don't have enough underrepresented minorities in medicine. Medical schools need to be accountable to the society. 2/3 of the medical education is paid for by the public dollar. I haven't had one student apply to medical school that says I'm only going to take care of insured patients. We take a white coat ceremony, they take an oath. When you go to the wards to do your first lumbar puncture, sticking a needle in somebody's spine, a thoracentesis in their lung and an abdominal centesis into their belly, I can guarantee you it's not the CEO of a multinational corporation. It's an uninsured indigent patient. Part of the same population that has helping you pay and become a doctor. Then you graduate and you take another oath. What happened to my profession? When did it become socially acceptable
that a physician can refuse a patient because they have no money. Not just that we do it, but nobody's bitching about that. When did that happen to my country? When did that happen to my profession? When did we clash the values of business and profession and business took over? We have a responsibility as physicians. We have a responsibility as educators.
We have a responsibility to make sure that every single medical student maintains their enthusiasm for medicine and their commitment to a societal mission. We have to make sure that our medical students acquire the knowledge and the skills to become true professionals, that we draw our students from all sectors of society. Yeah, that's right. In medical school, we screwed up in the admissions process because look at the products we came out with and the situation we're in right now in our country. It's not right. And we need to pay doctors in proportion to what they do. I'm a super subspecialist. I'm a hepatologist and gastroenterologist. I get paid for doing colonoscopies. Not whether they're good colonoscopies. Not even if they're indicated colonoscopies. I just get paid for doing them. When was the last time you bought a car because they made the most cars? Or are you actually checking to see the value and how good that car is? So you might want to measure us on our value. I'm competitive enough as, yeah, measure me. Hell, you've been doing that since I applied to med school. So why don't you do it now? We're a country that has some of the worst outcomes of industrialized nations, the worst outcomes of the top 8 industrialized nations, 38th ranking in the world, and twice as expensive as number 2. And in Dade County, we have twice the expenditures for Medicare. So we're 5 times higher than the rest of the world. I think there's some ethical issues we have to deal with in medical school too, to prepare our students properly. We have to foster greater interprofessional teamwork. Why? Because we can take care of those bodies floating down the river, but I'll be damned if there's one doctor that can fix a bridge. So we need to work with others and make this happen. Well, luckily here we did. Here, and led by George Dombach, and now by our Dean John Rock, we have our medical education, the 7 competencies we looked at and said let's form a curriculum to meet those competencies. But the one that makes this place unique is one of the competencies we have. It's called social accountability. We're going to be the very first ones to see whatever new drug is on the street. We're going to be the very first ones to see whatever new virus or new superbug appears, or new cancer, or anything else that's happening. So we have to be accountable to our society. Because why? Because that's part of a physician's responsibility. And wouldn't it be nice if medical schools were ranked, not by NIH funding, but NIH funding was dependent upon the contribution that a medical school does for its community, not its scientific discoveries, but the improvement in the health outcomes of the communities that surround that academic center. Because you know what? All of us, private and public medical schools, are underwritten by you, the public, whether it comes from Washington, whether it comes from the state, or whether it comes from the county. We need more underrepresented minorities. Only 7.3% of American medical faculty are underrepresented minorities. Only 6.4% of physicians are Hispanic. You might think they're all in Miami, but it's only 6.4%, and African Americans also 6.4%. Here at our medical school, we have a social mission to improve the quality of life of households and neighborhoods while educating men and women in medicine. We teach them the social determinants. What is that? The non-biologic causes of diseases. Whether that is poverty, whether that is lack of transportation, whether that is violence, whether that is racism. The fact that here in Dade County, an agricultural state, we have people living in food deserts because there's no supermarkets they can go to. With the gang wars going on, they can't exercise, and we're telling people to take their own responsibility. Where's the commissioners passing the laws to protect it? Where are the commissioners bringing in the supermarkets? Where's the commissioner sitting there making sure everybody gets educated and gets a job? In our curriculum, we have something very different, medicine and society. A department that no other medical school has, which is the Department of Humanities, Health, and Society, with this mission to graduate physicians who understand and include the non-biologic factors, social determinants, in the diagnosis, treatment, and care of their patients and communities. Something else. 2 of the 3 chiefs in this division, which is the largest one at the medical school, happen to be PhDs, social scientists. It's just not about biological and the basic sciences, it's the social sciences that influence disease more than the biological ones do. If you want to save children from dying in Latin America, you improve the water supply. You don't bring in doctors. you look at the social determinants. Our neighborhood health program, which is when we take our students from our ethical foundations of medicine to social determinants to interdisciplinary teamwork, and then we hook them up with nursing students, public health, social work students, and send them out into the community. And what happens? Well, of our first two cohorts, we've seen 233 households, 931 visits, over 648 students, including nursing, medical, social work, and law. Of that, the average household, 70% of the average income of a household, 70% of these households make less than $30,000 a year. Less than $30,000 a year for an entire household, and 51% have somebody uninsured in their family. Now, insured also means Medicaid and Medicare and third-party payments. What have these kids done? This is early data, but our students, just by intervening socially, because there's not a whole lot of health care in those areas, have reduced the use of emergency rooms from 61% to 26%. Mammograms from 56% to 81%, because when we superimposed cancer data on these populations, we found out we had, in these neighborhoods, the highest rate of metastatic breast cancer, triple negative, in women under the age of 50. Just by intervening socially. Blood pressure checks, physical exams, pap smears. When one of our surveyors trained in the neighborhood told us that she was so grateful that a mother sat there and spent 2 hours with her while her 29-year-old daughter sat in the back room dying of cervical cancer. Dying of a disease that has a 99% cure rate, and now we have a vaccine against it? In my country, in my neighborhood? Where the hell did we go wrong? Why are we not alarmed about this? Well, why do we need to change medical education? Because people's lives depend on it. Because somebody has to. Because as a nation, we want to be the best, period. And if we don't, we'll continue to fail those that depend upon us. And everybody at one time or another depends on a physician. I took this picture under a bridge near the Miami River about 24 years ago. And that's her sister sleeping behind her. And her mother was pregnant. And I look at that face, and those are the faces of the people that float down the river. And do you really think she had a fair opportunity at an education living under a bridge? Do you really think she can apply for school and take her SATs or take her MCATs? Who's going to help her with it? We as a nation, we as a people, we as a profession of medicine, we as educators have the opportunity to make us the best country in the world. Let us not let any more bodies flow down the river. Let's fix all those bridges, and let's make this world as healthy as possible.